I had just run a half marathon and came back home, started getting a clicking feeling in my hip, and I figured I had some sort of muscular tear. So I went to the doctor and they took a couple of x-rays and they diagnosed me with quite advanced hip arthritis on my left side. It felt like my life had gone on pause mode. I had to still be a mom and still work full time and be a wife, but then all the stuff that I like to do to release my stress from work and family life, I couldn't do it anymore. Dr. Fletcher and I finally sat down to discuss what was going to happen next after trying cortisone injections and physical therapy and all sorts of things. We sat down and discussed what the choices were. He was very good at letting me know that it was always my choice. I could wait if I wanted.
Iliana was the perfect same-day total joint replacement candidate. She's very healthy, she has a lot of support at home, she is very highly motivated, and she just frankly didn't want to have to be in the hospital if she didn't have to be. Technological advances that we're using at Norwalk Hospital, such as robotics with total joint replacement, also multimodal pain management, and the preparation that we offer to both patients and their families is what really has helped patients be well prepared for a same-day total joint replacement procedure.
On the day of my surgery, I woke up really excited about what was going to happen to me, you know, the transformation of me being able to be physically active again. It was an early morning. I woke up my kids, fed them breakfast, left them ready for school. I came to the hospital, had my hip replaced, and then I was back home already at 2 in the afternoon. So when they walked off the bus, I was already standing in my house with the door open waiting for them after the surgery. So within a day I was walking. Within a week I didn't need to use any kind of canes or any assistant devices. Within 2 weeks I was driving. I would say after a month the physical therapy team, outpatient, had me on the bike doing football drills, kicks, and weightlifting. It was pretty intense, so I would say a month after I knew I was going to get back to normal. If somebody would come and ask me about getting a hip replacement surgery and leaving and going home the same day, I would definitely encourage them to. There's no reason for them to stay in the hospital if they don't need you. I am looking to do an endurance athletic event next year where I'm going to be kayaking for about 80 miles and then cycling for about 20 miles and then running for about 10 miles. Very, very exciting. It's going to take me a full year to prepare, but I know now that I have the capability to start that training feeling amazing.